Welcome to Purpose Amidst Uncertainty. Where can we continue the mission of injury and violence prevention and public health work? This is the third of three brief on-demand videos that are part of the Career Planning Amidst Uncertainty series presented by the Student and Early Career Professional Special Interest Group at Safe States Alliance. In this episode, we're talking about how to hold on to your purpose in the face of so much ongoing uncertainty. While so much has changed and is changing about the field of public health, the one thing that hasn't is the mission to protect and promote the health and well-being of people in communities. So given all that is changing, how do we think about our work, our jobs, and our careers, and how do we stay anchored in this mission? My name is Catherine Guerrero, and I'm the Deputy Director at Safe States, and today I'm joined by Hannah Dunlop, our Communications Coordinator.
Hello, everyone. So happy to be here with you today, and I hope you've had a chance to watch the first and second videos in this series. The first one was presented by Safe States Alliance Executive Director Sharon Gill Martin, and she shared some insights into the changes and opportunities that we currently face in injury and violence prevention and public health careers. And that second video was presented by Eva Bland, our associate director here at Safe States, and she shared how skills and experience that many of us have gained through our public health work are transferable across sectors and jobs. And so after this third video that you're watching now, you have the option to watch a live session, which is an in-depth look at career planning amidst uncertainty. And the presenters there will be Catherine Brumfield, the Career Services Manager at the Colorado School of Public Health, my alma mater, and the Student Early Career Professionals SIG Chair, Hannah Rockford. And that live session will be held Wednesday, August 13th from 1 to 2:15 p.m. Eastern. If you miss that session, no worries, it will be recorded and housed on the Safe States webpage.
In the second video in this series, we took a deep dive into the experience and skills of public health workers and how we can think about the relevance of those skills as we work on our career path in public health. Today, we want to continue that conversation with a look at the settings or places where public health work is happening or may happen in the future. For those of you just starting out or maybe a few years into your career, you're coming into the field of public health at a time of unprecedented change and uncertainty. But even though uncertainty and change can be hard, we want to encourage you to remember that change can often bring opportunity and potential. Certainly things may not look like they did before. Our jobs may not be in the same kinds of organizations, but there's still a need for public health work in our communities, and there's still a need for the skills that public health professionals bring to the table. Before we dig into our conversation, I do want to note that part of what is happening in this current context is the potential for significant change to the structure of governmental public health, particularly at the federal level. We address these potential changes in the opening video of this series, but what I want to say here is that we don't yet know what the final structure will look like, what it will mean for the federal workforce, and how those changes will trickle down to state and municipal public health efforts. While there likely will still be some opportunity in governmental public health, we want to help you be as creative and as flexible as you can in your career planning. Traditionally, when we think about public health work, we think about these settings. So state and local public health departments, universities, non-governmental organizations and community-based organizations, and federal agencies like CDC, NIH, and others. We think of funding flowing through these few federal departments into these types of organizations to support data collection or community programming. But in reality, when we really dig into where public health is and likely will continue to exist, the picture looks more like this. Certainly, with all the uncertainty in federal funding, this picture is shifting. But what isn't shifting is the fact that there will continue to be a need for injury and violence prevention work, which means it has to go somewhere if it's not coming out of state health departments or federal organizations. And it's likely to be in other community spaces, allied organizations, and possibly in new sectors that will need to expand their focus into public health. So we might likely see injury and violence prevention work expand into multiple places beyond what we think of as traditional public health settings. Think broadly about the work you're interested in and reconsider cross-cutting settings, those related to upstream prevention concepts, as well as those related to broader health and well-being efforts. This can include insurers or payers, housing agencies, public libraries, community development groups, think tanks, behavioral health organizations, and others. Also, in our second episode on transferable skills, we talked a lot about the skills that many public health professionals have developed through study and experience. I would encourage you to make a catalog of these specific skills for yourself, and then think specifically about how those might be a value add to the organizations you're interested in working for. So if we go back to our circles and consider each of the sectors and organizations represented in these circles, they'll all be impacted by changes to governmental public health and changes coming in federal funding. But all of these agencies can also be served by the skills and experience that public health professionals have to offer. So as you're thinking about the breadth and depth of your injury and violence prevention skills, keep a wide view of the many fields and disciplines where you could transfer your skills and experience. For example, in my state, Blue Cross Blue Shield was hiring a youth violence prevention position at a good salary. In my specific city, a position was created in the last couple of years to identify and implement public health strategies to address calls coming into 911 that didn't necessarily warrant a police response. And as you're thinking through your skills, don't forget about soft skills and include these in your skills inventory. I had a colleague once who was laid off from her job in a leadership role at a domestic violence agency or a domestic violence program at a state domestic violence program. And she was heavily recruited by companies in very different fields, including a company that sold title insurance. And when she asked why these companies were so interested in her, um, one of the answers was because of her skills talking to people, her skills dealing with conflict and having difficult conversations. So soft skills that you've learned through your work in public health, talking about difficult things, asking probing questions, these can all be useful to different sectors as well. So Hannah, what's one job you or someone you know has had that advanced the mission of public health, but didn't look like a public health job at all?
Thank you so much for that insight, Catherine. I would say one job I had that didn't really look like public health from afar was a position as a project manager for a research study on the impact of mindfulness on conflict resolution in romantic relationships. And this position was through a university, so that little bubble there. From afar, the connection to public health may seem indirect, but public health is not solely about preventing infectious disease, as we all know, but about promoting mental, emotional, and social well being, which are protective factors against many chronic diseases. Connecting the communications based study back to public health, where when looking at social drivers of health, it reveals that our broader social environment can impact individual health outcomes, and relationship dynamics are part of that broad social environment. Additionally, mindfulness is a form of preventative care, teaching emotional regulation and potentially conflict management, which may reduce stress, which would be another health benefit. So not only was this position public health, but it was actually a form of injury and violence prevention, as intimate partner violence is a facet of IVP. Prevention efforts work to reduce that occurrence by promoting healthy, respectful relationships. And mindfulness was the independent variable and tool used to promote healthy relationships in the study. And while the results of this study aren't published yet, this is an upstream approach to public health, and it may not appear so as a glance. But this makes me want to think, Catherine, is there one job that you or someone you know had that advanced the mission of public health but didn't look like a public health job?
You know, Hannah, I would say I've had a few. I think the first thing that comes to mind is a consulting job I had working with a team that we spent about 6 months to a year building out a human service network for a specific state to use as a referral network for its Medicaid 1116 waiver. So it was a pretty exciting project. to address some of the social determinants of health, things like access to housing, food insecurity, transportation insecurity. So to address some of those issues, to try to decrease the use of the need for medical care among Medicaid recipients. And so got to know legal services organizations, domestic violence shelters, food security organizations, and really building out kind of referral processes and reimbursement processes for these agencies across a significant region in the state. Really taught me a lot about kind of community-based public health and where agencies that are doing work to address upstream social determinants factors, how they were operating, familiarity with their processes, and certainly served me later when I was back in a traditional public health role, um, working as a funder, getting money to flow through a state health department into communities. Um, I've also had a lot of experience in communities during work based in communities that I would call public health work that really were about building connection of some sort. So things like working in youth sports leagues. I ran a nature education program for kindergartners one year, teaching them about sort of, you know, kind of civic citizenship kind of principles and values related to nature and taking care of nature, all in the context of studying birds of prey, and doing annual counts of birds of prey on the Blue Ridge Parkway, right? So I think, definitely not traditional public health roles, but certainly involved in kind of increasing upstream protective factors for communities and members of communities, and certainly work that I think down the road helped me as I was thinking about what these community-based systems and organizations need in the way of funding or training or technical assistance. Um, so lots of fun jobs, maybe non-traditional public health, are out there.
Now that you have some examples of additional industries to apply your public health knowledge to, let's think about skills and qualifications. So one great resource from the Columbia University's Mailman School of Public Health offers a brief online guide called Navigating a Challenging Public Health Job Market. And many additional schools offer great resources. This resource includes ideas of how to think about identifying valued skills that you may already have, and then how to find roles that may align with those skills. So, your first step is going to be to identify those valued skills, and you're going to focus on public health roles and growing industries where your current qualifications are already highly valued. One way to do that is enter research the fastest growing industries is by using the tool Career One Stop. You can just click here and it has uh, a ton of different resources to let you know what fields are trending as well as skills. Then, secondly, strategic role selection. You're going to identify roles that align with existing public health skills while meeting the needs of growing industries. So, you'll consider opportunities in areas such as services for the elderly, people with disabilities, data science, management consulting. So, where public health expertise can be applied. So, going beyond thinking about expanded settings, but truly trending settings. Next, the resource touches on flexibility. So, the importance of geographic flexibility, understanding not everybody can pick up their life and leave, but if you are looking for a change in location, you can utilize the Bureau of Labor Statistics Occupational Outlook Handbook to find areas of the country that have fast growing roles, most new jobs, and various statistics that can help make your job search easier and find where people are being hired. And then next is desired employer flexibility. Even though you may have some organizations in mind, that may mean that others are thinking the same thing. So you can focus on organizations that may be less known or competitive within the public health sector. One way to do that is identifying employers with a lower ratio of LinkedIn followers to employees to reduce competition. Popularity can be a proxy for competitiveness, but LinkedIn is a great tool to use. Next, I wanted to focus on the importance of credentials and upskilling. One way to do that is to pursue further schooling for certifications in high demand fields such as data science. If you're unable to return to school, you can always be certified in education you already have, such as a certified health education specialist. Obtaining that certification could help solidify a position in corporate wellness. Additional certifications like project management and PMPs could be helpful. Or you could volunteer or create self directed projects to build new skills. It doesn't have to be in a job. You can analyze publicly available data to keep your art and SPSS skills up to date. You can create a portfolio and post it online. You can write grant proposals to have writing samples to submit with resumes. There's plenty of opportunities to upskill. The last section of the guide focuses on having an entrepreneurial mindset. You want to look for the hidden job market where other people aren't. To do that, register with staffing agencies and search firms or join networking groups and listservs. So State States has a listserv you can join for funding opportunities, job opportunities, and upcoming trainings. You can reach out to us for that. Also, we have a networking group on LinkedIn so you can connect with other professionals. You can also pitch your skills directly, identify a department of a company of interest, or reach out directly to a manager to share your credentials. If you want to meet more professionals and bolster your network, consider attending the Safe States Alliance annual conference, which is virtual this year, so you can attend from anywhere to network with hundreds of IVP professionals. Additional outlets are considering starting your own company. If you have a passion project that you want to work towards, consider consulting or part time or contract work. It doesn't have to be a traditional 9 to 5. Consider volunteering in relevant spaces that could potentially lead to employment, almost like practicum opportunities. And additionally, you can post positive content on LinkedIn regularly to emphasize your skill set. So, post about conferences you're attending, post about the work you're doing day in and day out. Nobody knows what you do until you share about it. Having an open mindset can really set you apart, but you do have the skills to make this work. Another way to view the power of your IVP skills is through advocacy. As Safe States is the national voice of IVP professionals, we advocate for policies and funding at the federal level on behalf of our members. However, there's a role for everyone in educating and working with policymakers. Safe States provides access to policy tools, resources, and programming to make it easy for anyone. Even if you're a governmental employee, you can still advocate in your free time. See how easy it is with Safe States Advocacy Action Center through the link and QR code shown here. Don't forget to attend the last live session in the series, Career Planning Amidst Uncertainty. This will be held August 13th from 1 to 2:15 p.m. Eastern, and we hope to see you there. Last but not least, follow us on social media to keep up with all things Safe State.